Heart attack is not equal to cardiac arrest. What is heart attack? Heart attack is equal to myocardial infarction. What's infarction? Infarction is necrosis. What's necrosis? Necrosis is death of cells. Myocardial infarction. What's myocardial again? Myocardium is the middle layer of the heart. Myocardial infarction means necrosis of myocardium, which is basically myocardial cells are dying. From the name, you can actually understand what's happening. So, infarction of the myocardium, necrosis of the myocardium, cell death happening in myocardium. Heart attack is like a plumbing issue. What's coronary artery? Coronary artery supplies blood to the heart. Why? Mainly for oxygen. Let's consider the coronary artery like a pipe. What happens when something is blocking the pipe? It got clogged. We call the plumber to remove the clog. Like that, the coronary artery gets blocked by a clot. Just like how when the pipe was blocked by the clog, water doesn't go through. Similarly, the coronary artery gets blocked by the clot. Now, the blood is not going to the heart. So what happens when the blood is not going to the heart? Oxygen. Oxygen is not reaching the heart cells. Basically, like a plumbing problem. The coronary artery gets blocked by a clot, so the blood is not reaching the heart cells. So there is no oxygen reaching the myocardium. That's why the necrosis happens. That's why we call it myocardial infarction. Cardiac arrest, it's like a electrical failure. You know how you say, oh, the fuse is gone, like that? It's like a complete electrical shutdown, like the flip off, boom, that's it. So why it happens? Yes, a myocardial infarction can be a cause of cardiac arrest, but it's one of the causes. There are other causes like electrolyte imbalances, hyperkalemia, arrhythmias. There are more causes to cardiac arrest. So what happens? Suddenly, the heart goes into complete arrest. There is no pulse. Oh, there's a patient, he's having a heart condition. How is it heart attack, or how do you say it's a cardiac arrest? Heart attack patients, if you see them, they're still conscious, they're having like a chest pain. Eventually, when they go into cardiac arrest, they collapse. Cardiac arrest patients, they lose their consciousness like this. They collapse, and mainly there is no pulse. Heart attack, the patient mostly is conscious or like semi-conscious, there is pulse. Cardiac arrest, there is no pulse, which means you need to start CPR very fast. That's why we use a defibrillator in the cardiac arrest. Basically, heart attack is like a plumbing issue and cardiac arrest is like an electrical issue. This is how I studied the difference between heart attack and cardiac arrest in my internal medicine rotation during cardiology. So I just wanted to share it to you guys for knowledge purpose. So hopefully you find it useful.